in the AHS scientific meeting, I also gave a presentation reviewing the AI applications in headache, current and future research applications. So I think this is really an exciting field in the AI world, that from based on kind of several development kind of in the headache field and also in the non-headache field, it has drawn a lot of attention in how we can utilize AI in headache medicine. So I think, so I conducted a pretty detailed review of the literature, and in the presentation, I summarized that AI could be used in different aspects in headache medicine. So for example, there has been AI studies to help us with headache diagnosis, headache classification, and also subtyping of patients in like even with the same diagnosis, for example, with migraine. AI can also be used to predict treatment response, so identify predictors to help us predict which patients would respond to which medications. So that is another application of AI in headache. In addition, AI and big data analysis can also be used to gain insights from different data sources. So for example, there have been different studies leveraging data from social media like Twitter data or headache smartphone application data to do different types of analysis to gain insight on how patients report their migraine in the social media, for example, or how we can utilize electronic headache diary smartphone applications to gain insights on, for example, comparing the effectiveness of different acute medications and etc. Additionally, I also reviewed on the development of large language models. So for example, ChatGPT, since it's emerged in December of 2022, it has really gained the public awareness of generative AI. And has really pushed the field or created a paradigm shift of the AI field to move from predictive AI to generative AI. So we not only want AI to predict what will happen to a patient, we also want to be able to leverage the different types of generative AI tool to help in patient management. So for example, so it really pushed from predictive AI to generative AI, and generative AI it can also generate images, like there are different AI programs that help us generate different types of images that can be used in some way in medicine as well. In addition, AI can also generate like music or videos. So in the clinical practice, so for example, with this new trend of generative AI, there has already been different potential applications that are currently under development. So for example, from a clinician perspective, there have been studies trying to develop whether AI can help, for example, physicians draft a response to patient messages that we are receiving in the clinic, or whether AI can help physicians generate clinical notes based on the diagnosis or lab results in the EHR, or whether AI could help to generate test questions like USMLE test questions. And those are different types of applications that are currently actively being studied. So I think in addition to kind of predictive tasks like asking AI to tell us what will happen to a patient or what is the diagnosis of the patient, AI could also potentially help clinicians to improve the clinical efficiency in terms of like day-to-day kind of activity. However, I think that it will be important for us to remember that AI models depend on the data that it was trained on. So for example, whenever we evaluate an AI model output, we have to think whether this model was trained on, for example, data that came from a tertiary headache center, or data that came from the primary care setting, or data that came from the internet in general, because those could potentially affect the output of any type of AI model. So it's important to remember to always evaluate the accuracy of or potential bias of a model output. And in addition, with this newer generative AI thing, like the large language model, it is pretty well known that it could potentially make up things. So, for example, people call ChatGPT could hallucinate, which means that it can make up things that don't necessarily exist. Which, from a neurologist standpoint, I think confabulation or fabrication is really a better word. Is really a better word than hallucination. But anyway, I think it's important to kind of evaluate those model output to make sure that those are really factual and accurate, and make sure to evaluate for potential bias as well. It is important, especially with potential AI applications in headache, to remember that there are new research coming out kind of pretty rapidly, kind of every day. So there's certainly an excitement in the field to bring more kind of AI, big data analysis, or machine learning into the headache field using different novel technologies. So stay tuned on how we could use this novel tool to explore different aspects of headache medicine, and excited to see the development of the newer development of and potential applications of AI in the headache field.